Hi guys, Heather here, and in this video we're going to talk about the difference between being trauma-informed and treating trauma. And we want to be really clear that all the things that we do on our YouTube channel and on our website, and even in the workshops that we hold, they're all for educational purposes only. They're not about diagnosing or treating trauma. So basically we're giving you tools to recognize and then respond to trauma, whether that's something you've experienced or whether it's something that someone you're interacting with has experienced. So Moylan's going to come on now and talk about how this impacts specifically you if you're a body worker.
Hi everybody, I'm just going to take a few minutes to talk about how it is for body workers to work with clients that present themselves with trauma. Now for me, I have experienced what it's like to be a massage therapist and not stepping beyond our boundaries, our scope of practice. But also I've trained and worked in the field of actually working with trauma as a somatic psychotherapist. So I have an experience in both fields. I feel one of the most important things as a body worker is to remember that we're not a psychotherapist, and we don't have to analyze or judge or categorize our clients. The biggest thing that we have to focus on is just to be present. So it's very important that we have a sense of our own embodiment and our own presence to ourselves. And in doing so, that we facilitate the allowing of whatever is going to come through. The most important thing for body workers is to create a safe type of holding for our clients. Sometimes as body workers we become fearful if we hear that somebody might be coming that has some type of trauma, because there's an expectation of us trying to fix them or whatever. Honestly, if you can unburden yourself from those type of thoughts, you can then align yourself with just being yourself and being present with your clients. When the client's body feels safe, it will start to unwind. The stories that have created this trauma will become untold through that unfolding, and their issues that were in their tissues will begin to leave. It sounds like a simple process, but sometimes as body workers we have a tendency to get in our own way. And one of the things we have to overcome is the fear. But to alleviate that fear is to move beyond the need to fix our clients. So in our programs, we give you tools to allow us to be able to respond to a client in a way that sets up a deep connection, an empathic type of support, a communication that supports this sense of deep safety, so the client can feel secure. When the body is evoking some type of a memory or whatever, that it's okay for them to bring their emotions to the table. It's okay for them to be real, and it's okay for them to be themselves. And all we do as body workers is become a witness of that truth. And it's by witnessing the rebirth of that of the client is that they move way beyond the contracture that has been imposed on them.